Okay, good deal. All right, good afternoon, everyone, and welcome to another episode of College and Career Pathways, where every Monday, Wednesday, and Friday at 2 p.m. we provide you with information on various colleges, universities, skilled trade programs, technical professions, career exploration, employment opportunities, and career readiness skills, all designed to help you make the best career decisions possible. I'm Toni Cureton, your host, and today we are speaking with Flint Healthcare Employment Opportunity. They are a wonderful program in the Genesee County area, offering free healthcare training in various careers in healthcare. And welcome, Ms. Green. We're so glad to have you. You can go ahead and share with us about Flint Healthcare Employment Opportunity. If I wasn't already in my profession, I would consider going into yours.
Perfect. Well, thank you, Ms. Toni, for having having us here today. I am Aquasia Green. I'm actually a career advisor with the FHEO program, as well as I focus a lot on community outreach as well as recruitment. And so what I'm going to do is I will actually share my screen. And once you are able to see my screen, please let me know.
There you go.
Perfect. Okay. Alrighty, so this is the PowerPoint that I'm going to display today. So this is the first step in terms of becoming eligible for our program, in which that is attending an information session. And this is for all of our entry-level healthcare professions. In which, so here you can see, let me minimize this, give me a second. Okay, so just to introduce you to our staff, our program director is Ms. Penny Popular. And then Shannon Coulter, she's actually one of our managers. She's over career services and employer engagement. And so she works a lot with the employers throughout Genesee County, Shiawassee County, and the Thumb County. Yes, our program, we do offer free healthcare training for entry-level positions. And so our goal is to, of course, get our participants through the program, get them certified, but we also want to make sure that they secure employment once they graduate. And so Shannon works a lot with the employers within the counties to make sure that we are, one, aware of all updated job openings, as well as making sure that we can get our participants placed if they need the assistance in doing so. And then we also have Mr. Sharp on our team, which is the other career advisor. And as I mentioned, my name is Aquasia, and I'm also a career advisor outreach specialist. So we are a small team, but we are super mighty in helping getting our participants through their training programs. So the FHEO program, we are actually one of the programs underneath the Greater Flint Health Coalition. The Greater Flint Health Coalition was actually formed in 1992 by community leaders, and we are actually a nonprofit organization in which we are dedicated to improving the health status of Flint and Genesee County residents. GFHC actually runs a number of programs to help children, adults, and seniors within the community, in which we believe that we want to help improve the health status within the Genesee County, Shiawassee County, Thumb County areas. And so I always think of GFHC as an umbrella or a hub in which there are a ton of programs underneath our umbrella. Some of our more well-known programs is Commit to Fit, in which that program, they do host a lot of healthy lifestyle events such as Commit to Fit Challenge. They do a lot of cooking, free cooking demonstrations with not only adults, but kids as well. And then we also have Genesee CHAP, which is the Community Health and Access Program, in which they do provide different resources to the community in terms of helping to increase the health within the surrounding counties. And so what that consists of is maybe getting individuals connected with a healthcare provider. A lot of people don't have primary care physicians, so they do help to establish that relationship within the community, and other things such as providing individuals with car seats if they need them for those new babies and things of that nature. And as you can see here, there are a few other programs listed as well, in which again, the FHEO program is underneath the GFHC umbrella. Now, to give a brief overview of the FHEO program. So FHEO was established in 2002, in which the program is available to all Genesee County, Shiawassee, and Thumb County residents who seek training and employment opportunities within the healthcare field. The FHEO program is the healthcare provider for GST Michigan Works. I know Michigan Works is fairly known throughout the state of Michigan. They do offer a ton of training programs such as welding and things of that nature, in which they do pay for that as well for free. However, FHEO, we actually took over all of their healthcare. So we are in partnership with Michigan Works. And so we do follow all of their policies, procedures, and things of that nature to make sure our participants are successful. The GFHC program as well, or excuse me, GFHC and then the FHEO program, we do partner with a ton of individuals throughout the community as well as organizations. And so as I mentioned already, we do work with Michigan Works. Down low here, if you can see where it says our partners, we do partner with a lot, but some are listed here. So McLaren, Flint, Hurley. So as you can see, we do partner with a lot of the major hospitals within our area, but then we also work with some of the smaller organizations within the county as well. So like your dental offices, doctor offices, and things of that nature. Now, in terms of being a participant within the program, there are a lot of things that you receive. So as mentioned before, you do receive free tuition. So we do provide free tuition for credential training, and required classroom materials are also covered. So not only do we pay for your tuition, but we pay for your books. Some programs do require scrubs, so we pay for those. Some require shoes, we provide, or we do pay for those as well. Some require the stethoscope, and I can never say that right, but we do pay for that as well. As a program participant, you also receive free career advisement. So as I mentioned, myself and Mr. Sharp, we are the career advisors on the team. And so we do serve as additional support for our participants while they're going through their healthcare training, as well as post credential, or once they receive their credential as well. So we want to make sure, yes, you receive your credential, but we want to make sure that you also obtain a job, and we do follow our participants a year post credential. As a participant, you'll also receive supportive services. And so what that consists of is, we know transportation is a huge barrier in terms of individuals making it to and from, whether it's school, work, whatever the case may be. And so we can assist with public transportation, in which that is providing bus passes. And we do provide mileage reimbursement as well. So if you are driving to and from your training program, or someone is helping with that, then we're able to provide mileage reimbursement. And there are other services available as well at request. Another perk that you receive with being a participant underneath the FHEO program is we do host empowerment sessions throughout your time in the program. And so what that consists of is guest speakers as well as program staff present information on employability skills as well as other community resources. So a big thing, especially in the time of social media and in the age of COVID, where everything has gone remote. A lot of people don't necessarily consider the fact that employers do have access to some of your social media if that is open to the public. So we talk about social media do's and don'ts and things of that nature. And then again, providing other community resources to our participants. And then you also receive, as a participant, job development assistance. So we do help you with interview preparations. We do mock interviews if that's something that you deem necessary, or something that will help you in your quest to finding a career within your chosen path. We do resume revision. So we want to make sure your resumes are in tip-top shape so you can catch the eye of those employers who are looking. We do help with application assistance as well. So we'll help you with those applications. And then we also have those employer connections. So as I mentioned on the previous slide, GFHC and FHEO, we partner with pretty much everyone that you can think of within Genesee County, but then of course outside in Shiawassee and the Thumb counties. But with that being said, our participants have a leg up to their counterparts, so others who are interested or who are like CNAs and things of that nature. But our participants have a leg up because we have those connections with employers. So take, for example, Hurley. Hurley sits on our board, as well as they sit on our interview panel when it comes time for interviews. And so they know exactly how much work our participants put in into becoming well prepared, well-rounded once they get out, and not only into their training program, once they graduate, when they get out into the field. So Hurley individuals, those who sit on the HR board, they look for our participants once they're ready, like, okay, we know for a fact that FHEO graduates, they are exactly what we're looking for, because not only are they aware of what our program entails, but they also give us feedback. So after our participants interview, they give us feedback like, hey, this is what we're looking for, this is not what we're looking for. So we're able to better prepare our participants next time around. So how to get started. So should this be anything you are interested in the future, there is a new career waiting for you. And so the first step in becoming a participant within the FHEO program is you do have to meet our eligibility requirements. And what that looks like is being, number one, a resident of Genesee County, Shiawassee County, or the Thumb County. So you have to be a resident within those 3 counties, and you have to have a high school diploma or GED. Now, the third step is there are a few qualifiers for each one of our participants. It does vary per person. However, some of the most common qualifiers, and again, this is not the whole list, we have a large list of qualifiers, but some of the ones that we see the most is youth. So anyone between the ages of 18 to 24. We also see single parents, low income, and those who are veterans. So those are some of the ones we see the most, but again, that is not the entire list. So don't freak out if you feel like some of those qualifiers do not pertain to you. There are other qualifiers that can get you eligible for our program. Once you meet the eligibility requirements, then we move over to the recruitment process. So you do have to complete that process. And what that looks like is all of our participants have to submit and complete, I should say, our official application. It's done online, pretty straightforward. You're just filling out your demographics and things of that nature. We do have all of our participants complete our HCR, Healthcare Fit Assessment. A lot of people get freaked out when they see assessment. It's not a test by any means, but it's literally a list of questions that assess whether or not your program of choosing is the best for you, and if not, what can we do to get you on that to that level. After that, we do email over, and this is a little bit out of order, but we do, following an information session, we actually email all of our participants with the link for the application as well as the link for the assessment. And we also attach a document that lists out all our required paperwork. So what's needed for you to move forward. And so what that looks like is an ID or driver's license. We do need the front and back of that. If you're receiving any state assistance or anything of that nature, we do require that. But again, we attach that, so that allows you to start prepping those documents to turn in once that due date comes along. At that point, we do get you scheduled to then do our CASAS testing. And so what that consists of, that is in person versus the HCRA that is done online. With the CASAS testing, we do test you on reading and math. It's not like super extensive by any means. So again, don't freak out about that, but we do have to test you on reading and math. We do submit a background check. So that is done once you complete that application. We get all your information. And then as I mentioned, we do interview all of our participants. So that is completed with not only our program staff, but that's also with local human resource representatives. So as I mentioned, Hurley, they do sit on our board for that as well. Following the completion of the interview and you taking that CASAS assessment, we then get you scheduled to attend our program orientation events, in which that is something we do go over in more detail as we get closer to. And then from there, all of our participants actually attend and graduate from our life skills and healthcare career exploration training, which is hosted by Flint Strive. And to kind of go into a little more detail in terms of that life skills training. So that is 160 hours of training hosted by Flint Strive. So that's roughly 2.5 weeks of training. The training itself is designed to address the specific needs and concerns local healthcare employers seek in employees, such as patient care, confidentiality of patients and employees, understanding of healthcare, of the healthcare environment and the mission of healthcare, as well as conflict resolution. Something I like to point out a lot, confidentiality of patients and employees, that is your HIPAA laws. So they do cover that information. And then the life skills simulated work environment is an opportunity for individuals to develop the following skills. So punctuality, professionalism, communication skills, multitasking, communication, teamwork. This is everything that is covered during that 160 hours of training. So there's a lot of interactive things that are involved with the Flint Strive program. Now, and we do have different pathways for our program. The main one is our entry level. So that is individuals who are traditionally between 18 years and older, who don't necessarily fall into our youth category, in which we do make that determination as we get further into, or right before we get into our individuals attending Flint Strive. But with our youth, there are some incentives that come with that pathway. And so that is, again, anyone who is between the ages of 18 and 24 that meet the eligibility requirements. Some of those incentives include talent tours. So we do set up talent tours for our youth participants, in which they're able to visit multiple departments within the healthcare facility and experience the hands-on learning about different healthcare options. So we do that a lot at Hurley. For example, our participants do go through different departments within Hurley, speak with representatives on those specific floors, and learn more about the careers that are available. And then there are also different performance incentives. So our youth participants do receive monetary incentives based on 3 different things. So they receive monetary payment, basically, for the completion of the healthcare certificate. So if I have a youth individual who goes through the CNA program, they graduate, they get their certification, they receive a monetary benefit incentive, for completing their certification. They also, if successful, receive a monetary incentive based on subsidized employment, in which I'll talk about that a little down the list here. So there's incentive there, as well as receiving full placement into employment. So once our participants receive their certification and they obtain a job, they also receive another monetary payout for doing so. And so what that subsidized employment opportunity, what that consists of is our participants are paid to work, they participate, in paid work experience with local employers, in which that provides opportunity to work in the healthcare environment and earn money. So they're training, they're learning. Our participants are getting that experience within the healthcare field without that commitment, for lack of a better term, without that commitment of actually being an employer with that employee within that specific facility. So you'll work with them for, let's say, 4 weeks, and you receive 4 weeks of pay, but you're getting trained to do so, and while also from that point, continuing out the said program training. So whether it's CNA, pharmacy tech, whatever the case may be. Now, these are the current programs that we offer training for. So we do have our Certified Nurse Assistant program, in which that is a 4-week program. We currently work with Charter Healthcare Training Center and Mott Workforce Development Center. We also have our dental assistant program, in which that is 8 months, and we do work with Ross Medical Education Center for that program. We also have a health unit coordinator training program, in which that is 4 months, and that is hosted also through Mott Community College. So that is at the university or the college itself. And then, as I mentioned, CNA, that's through their Workforce Development Center. We do have our medical assistant program, in which that is 6 months, and that is also through the Mott Workforce Development Center. We have our medical billing and coding program, in which that is 5 months, and that's through Ross. We have our pharmacy tech program, that is 5 months, and that is through Charter. And then we also have our phlebotomy program, which is 4 months. Now, I recently was able to visit Charter Healthcare Training Center. It was my first time being there. And when I say their pharmacy, both their pharmacy and CNA programs are amazing. However, I was able to see the training area for the pharmacy techs, and they literally have it outlined or set up to where you're getting a training, or if there's a simulation where you're in a store. So you may be working at Walmart in the pharmacy tech area. They also have like your traditional healthcare facility set up. So it's pretty cool. It's super interactive.
So
Oh, mhm.
I see that each vocation has a certain amount of time of training. During that time, is it Monday through Friday during the day, or is it evenings?
So traditionally, most of them are like your traditional Monday through Thursday, Monday through Friday in the day. However, I do know it's based on what the training center has available. So traditionally they are during the day. However, I do know that evening or late afternoon classes have been available as well, especially with like my community college, because it's based on like your traditional college setup where they have morning classes or afternoon classes or evening classes. So it just depends on the training center themselves and what they have available. But we let that information, or we make that information known to all of our participants once we get to that step as well.
And all of these are in-person training, not virtual.
The medical billing and coding, that one is online.
Oh, wow.
Yep.
Yeah.
That one is completely remote.
Okay. Okay.
In one of our other programs, we did offer that online, or the university did offer that online, but we found that it wasn't necessarily the best setup for our participants. I know me personally, I do not like online classes. I prefer to be hands-on. And so I say all that to say we do thorough research in terms of the success rate for all of our programs. And if we deem, hey, maybe this is not the best based on the data that we compile, then we'll scratch that program and go with another one to ensure our participants are successful in their program. All right, so in terms of planning for success, so if this is a program that you're interested in the future, we do like to kind of point out a few things that we do look for before our participants actually get started. So as I mentioned before, we do run a background check, not only for our program requirements, but with most jobs, I'm going to say 99% of jobs, when you go to apply for that job, they do run a background check. And that's really big in the healthcare field. So we like to point that out. Background checks are ran. We do drug screen as well. Again, that's not only a program requirement, but in the healthcare field, for sure, they do run drug screens, or they do send you for drug screens. And we do like to point out as well, we do understand that some substances are now legal within the state of Michigan. However, most healthcare facilities do still check for those substances. So just something to keep in mind. There is a time commitment. So not only do you have to get through the initial steps, our requirements as a program, so that's attending Flint Strive, orientations and things of that nature, as well as interviews. That is a time commitment, but once you get into your program, that is a time commitment. So whether you choose CNA, which is 4 weeks, whether you choose another program, that's 4 months. You have to dedicate the time to make sure that you are successful. We're going to give you the tools to be successful, but that time commitment is a huge thing in order to be successful within the program. And then transportation, of course. So we want to make sure that you plan ahead for transportation. Again, we understand that as a barrier. So if in fact you need a bus pass, that's something that needs to be communicated to the program. If you have to arrange for transportation, so whether it's a parent, a sibling, whomever who will be taking you back and forth, make sure you have that plan A, B, and C in order to make sure that you can make it to and from your not only your Strive, but also your program. A lot of the programs, they do only allow X amount of days for you to miss. So again, we want to make sure that you are planning for success and getting that in order. So if this is something in the future that you are interested in, as I mentioned, the first step is to attend an information session such as one of these. But we also have you fill out our application. We have you complete our HCRA assessment. We ask that you identify and locate those required documents that are attached. We do have all of our participants, if deemed necessary, we do have them go on to bls.gov. That website actually lists out every single career path that you can think of, and what it entails to one, become, or become, for example, a CNA. What it takes to become a CNA. So the education requirements, background, things of that nature. It also says what the average salary is, what the average hourly rate is, how many hours you work a week, things of that nature. So it really allows our participants to do a thorough, get some thorough knowledge in terms of the program that they may be interested in. We do have some individuals who may be debating in between like CNA and pharmacy tech. So we direct them there, do your research, see if this is something that really interests you. And then from there, as I mentioned, we do get our participants scheduled to take another test and then schedule them for an interview. And so that is all I have. I will, if Ms. Tony would like, can open up the floor to any questions, if you all may have any, or however Ms. Tony would like to proceed from there.
I would like to start with a few questions.
Absolutely.
The first one is, what would be the first one is, are all of those positions licensed or certified once they complete the training?
Well, not right when they complete it. So once they complete the training, then we get them scheduled to test for their certification. Yep. So we do get them scheduled to test for their certification, which we do pay for that. That's all included in their tuition. Yes.
Question number 2.
Yes.
The payment for that's excellent.
Yep.
And
yep.
Then,
so we pay for their certification. And something I did want to bring up too that I didn't mention, as I did kind of mention or allude to a little bit, we do have different pathways for our program. So the most common one is, again, our entry level and then our youth. But we also have our advanced students as well. So this is for anyone who wants to continue their education within the healthcare field. So anyone who's interested in, say, becoming a LPN, a licensed practical nurse, or a registered nurse, or a respiratory therapist assistant, PTA, which is physical therapy assistant, things of that nature. We're able to help those advanced students as well. Now, we cannot pay for their tuition at 100% because becoming a nurse and things of that nature, that program is really expensive, but we can help them in their last 3 to 4 semesters or modules, and that includes their tuition as well as books.
Oh, wow. That is really awesome. That is really awesome. You know, because I was going to say, once they get the certification at the entry level, of course, many of them want to continue on. And normally my suggestion is get with a healthcare employer that provides tuition reimbursement.
Yes.
And that will help mitigate your expenses, your educational expenses. And then now that you're offering the last 3 semesters worth of tuition and books, that's super. Wow.
It's amazing. It is amazing because that's a big chunk of money that you don't have to either worry about coming out of pocket for initially or in the end. Because me personally, to put it in perspective, I just got my master's degree last May. So that is 2 degrees under my belt, and I am in a lot of debt. So I wish I was more aware of programs like this and took advantage of programs like this, because it's definitely, can cut out a lot of that money that you have to pay back.
Yeah. Next, I wanted to know, what are the pay ranges between the positions, the starting rates of pay for the positions?
Absolutely. So it does vary, I will say, just based on the employer, but generally speaking, and I want to say too, since the COVID pandemic, we've seen a large increase in healthcare positions, because not only do we need more people to tend to individuals who may or may not have contracted COVID, but you have to take in consideration too of employees who were already working in the healthcare facility that may have gotten COVID or can't work because of healthcare or health related issues. And so the facilities are then adding more positions like, hey, we need to backfill these positions, or we just have a huge demand. So right now, healthcare in general is always going to be in demand. Healthcare, healthcare providers will always be in demand. However, now things are like amplified where they always need more. So to kind of put it in perspective, at one point, like CNAs were making like anywhere between $10 to $12 an hour. And now we're seeing 14, 15 plus an hour. Medical assistants were probably making around the same. Our program right now, or one of the programs underneath the umbrella, they're hiring on a contractual basis, a medical assistant at $18 an hour.
Wow.
And to kind of put that in perspective, my previous job, I actually worked with mostly LPNs and RNs, but I also worked for CNAs. When I first started that job, our LPNs at the time were making $18 an hour. So medical assistants are now making $18 an hour. And so your nursing student or nursing professionals, they're making more than that now.
That's great. When students are enrolled, they complete the application process and they get accepted into one of the programs. How is the instruction? Is the instruction so that if they are having difficulty, there's assistance to help them through so that they can be successful and complete?
Absolutely. So once our participants are in the program, so once they've been accepted, we do go over our participant agreement / contract, in which on that we do cover not only our expectations for our participants, but what our participants can expect from us. So what the biggest thing, and I like to reiterate a lot, is communication is key. We're going to reach out to our participants X amount of time, and I'll cover that in a second, but we're going to reach out to them. But if our participants aren't either one answering the phone or returning our calls, then we're kind of at a dead end to a certain degree. We can't help you if we don't know you need help. So what that communication looks like. So once the participant has been enrolled into the program, or once they are eligible and enrolled into the FHEO program, they go through Flint Strive. Once they graduate, we go over again that contract participant agreement shortly after they join their program. So once they join their program, depending on the length of their program, it is our responsibility as a program to reach out to our participants at least once a month. Now with our CNAs, that's a little different because their program is shorter. So they're only 4 weeks. So we'll reach out to them once a week. So throughout the duration of their program, until they receive their certification, we do reach out at least once a month. And we always like to reiterate, if anything comes up between now and then, whether it's on our end or our participants' end, we'll reach out or we ask that they reach out. So I may talk to someone on a Monday and that's our contact for the month, but something may come up on Friday. Call me. I can't help you if I don't know. But following the completion of their program and they receive their certification, they then get switched to our retention side of things, in which we do follow them for a year.
Wow.
And yep, so we follow them a year post certification to make sure either A, they've secured employment, and or B, they if they haven't secured employment, what do we need to do? When I say we, us as a program and the participant, what do we need to do to help you secure employment? So we'll follow them for a year post credential.
So then conceivably, everyone that's been accepted in your program pretty much comes through successfully and are placed and employed gainfully.
Correct. So everyone who is committed to the program, yes, they do. So I think our success rate is between 86 and 89%.
Wow, that's pretty awesome.
Yep. So again, it's based on the participant, whether they commit to that time, as well as communication. Yes, they can absolutely be successful.
Good deal. This is excellent. Does anyone have any questions that they want to put in the chat box that I can ask before we conclude, Ms. Green, do you want to put your contact information, your website?
Absolutely. Uh-oh. I can put that information in here right now. Okay. Stuff here. And what I'm gonna do is put in our general email address, because everything, we can't personally email from our personal emails. I don't know, but everything automatically populates into our general email. So we all see it.
Good deal.
And I will also include our website. There we go.
Good deal. There you go. Well, again, thank you guys so much for attending. Thank you, Ms. Green, for your time. I love your program. Oh my goodness.
Thank you. Thank you so much for having us. I'm so glad I was able to
Absolutely.
share our program.
Absolutely. It's phenomenal. It is an excellent opportunity, and it is unique in that these opportunities, you don't know how long the window is going to be open for.
Absolutely.
And so if you're in a position where you can take advantage of it, now is the time to get
Absolutely.
it, to make the call, to go on the website, to fill out the application, because, you know, as we see what we're currently in, things change drastically. And, you know, who knows what opportunities will be available, you know, a year from now or whenever. And so
Absolutely.
this is great.
Absolutely.
This is so great. Thanks so much again, you guys. No questions? I got a hand raised. Let me see. Before I go. Okay, Moto Gray, I'm looking at your hand raised. Do you have a question? Or you were just saying cool presentation, because it really was. You can type something in if you have a question. All righty then. Well, in that case, we will conclude. Thanks so much again, you guys, for joining. Thank you, Ms. Green.
Thank you for having me.
I will be in touch with you to reach out and have you back.
Absolutely. Absolutely. Thank you so much for having me, having the program, and I hope you all have a great weekend.
Absolutely. Same here. Have a great day, everybody.
Bye.